Have you ever stood up too fast and felt your heart race for a second? Maybe your vision blurred, your head felt light, or you needed to grab something to steady yourself. That quick moment can feel harmless, but for some people, it happens often enough to be worth paying attention to. When you go from sitting or lying down to standing, gravity pulls blood downward. Your body has to respond fast so enough blood keeps reaching your brain. Normally, your heart rate increases a little and your blood vessels tighten to help maintain stable blood flow. That adjustment is usually automatic, and most of the time, you do not even notice it. But when that response is slower or weaker than expected, you may feel dizzy, unsteady, weak, or like your heart is beating harder than usual. Some people call this a head rush. In more formal terms, this can be related to orthostatic hypotension, which means a drop in blood pressure after standing up. A blood pressure drop can briefly reduce blood flow to the brain. That is why some people feel lightheaded for a few seconds after standing. It does not always mean something serious is happening, but it is still a signal worth noticing, especially if it happens often. There are a few common reasons this can happen. One of the simplest is dehydration. If you have not had enough fluids, your blood volume can be lower, and your body may have a harder time adjusting when you stand. Another reason is staying in one position too long, especially if you have been sitting or lying down for a while. Some medications can also affect blood pressure regulation, and in some cases, certain health conditions can make the body slower to respond. You may also notice symptoms in different ways. Some people feel a brief spin or head rush. Some see things go blurry for a moment. Some feel weak, shaky, or slightly nauseous. And in a few cases, people may feel like they're about to faint. If this happens once in a while, it may be mild and temporary. But if it happens repeatedly, lasts longer than a few seconds, or leads to fainting, that is something to take seriously. The same is true if it happens together with chest pain, shortness of breath, or severe weakness. There are a few simple habits that may help. Stand up more slowly instead of rushing from sitting or lying down. Drink enough water throughout the day. Avoid staying still for long periods when you can move around safely. And pay attention to whether the symptoms happen after meals, after exercise, or when you are tired or overheated. If you want to support healthy circulation, regular movement can help too. Walking, stretching, and breaking up long sitting periods are simple ways to keep your body more responsive. You do not need extreme workouts for this. Even small movement throughout the day can make a difference. The main point is this: if your heart races every time you stand, do not just ignore it. Sometimes it is a minor issue. Sometimes it is a sign that your body needs more hydration, more movement, or a closer look from a healthcare professional. Noticing the pattern early is the best first step. This video is for general education only and is not medical advice, diagnosis, or treatment. If you have recurring dizziness, fainting, chest pain, trouble breathing, or any concerning symptoms, please speak with a licensed healthcare professional.